Welcome to the November edition of Focus on Crestview on Cox Channel 6. Today we have our November breakfast sponsor, Covenant Hospice, and with me today is Susie Clifton and Jenny Perkins that's representing Covenant Hospice, and they're here to tell us a little bit about their business. So thank y'all for being here today.
Thanks for having us.
It's hopefully will be a good time, and when we get through, the people out there in the TV world will know what Covenant Hospice does and have an idea of the services you provide, and you'll be able to tell us if we need you, where we can go, and if there's somebody in the community that might need you, how they can interact with your organization, or maybe how businesses in the community can interact with your organizations and help y'all do the good things y'all do.
Absolutely. We are so grateful for the opportunity to be here today and of course to continue our relationship with the Crestview Chamber.
Well, thanks. And it's great to have businesses such as yours that see value in being a breakfast sponsor, because, of course, you get to be on this show that's viewed in Okaloosa County, and you, of course, at the Chamber Breakfast, you're in front of 300 people, and at the same time, the Focus newspaper goes out to 7,000 people. So for the little bit of money you spend, you couldn't buy that in time out in the community. So it's a great tool to get in front of business people that are doing things in the community. So we appreciate y'all for supporting us, and at the same time, hopefully we're getting your word out.
Absolutely.
Well, tell us a little bit, Jenny, if you will, tell me, what do you do for Covenant?
Well, I'm the development manager, which means that my primary function is to really tell the story of Covenant Hospice, to let people know who we are, what we do, who we serve, and how they can be a part of our mission. We say that our goal is to add life to days when days can no longer be added to life, and it's certainly our pleasure and our opportunity to come into the lives of people at such an intimate time. And so many times after we've served a family, they want to give back in some way. And so I have the opportunity to share with them and the business community as well how they can get involved in our mission and help support us in what we do.
Well, Susie, what is your position? I know you do something a little different than Jenny, but we see both of you guys all in the community. So tell me, what's the different role you play in Covenant?
Jenny and I team up a lot, but my actual position is called the community educator. So I am out in the community educating not only the community, but the physicians and anyone else that needs education on hospice. So a lot of times that is people, that includes doctors, the community. Like I will go to the chamber and do lunches or whatever that entails. I also go into people's homes, that needs information on hospice. So wherever education is needed for hospice, that is what I do.
Well, a lot of people might not know the term hospice or really what you do, but in general, what does a hospice do, and what specifically does Covenant do?
Well, Covenant actually is a not-for-profit organization, and we provide end-of-life care. And that is probably a term that a lot of people do not like to hear, and so we hear that a lot when we're out in the community. And it is a myth, that a lot of people, when they hear that word, they automatically get defensive, or they don't want to hear the word hospice. They get so nervous when they hear that term. So that usually is where I have to come in, because a lot of physicians don't even want to talk about it. So that's usually when the physician doesn't want to have that difficult conversation, I come into play. I usually have to go in and talk to a lot of families and talk to them about hospice and talk about what end of life means. And like Jenny said, we're not coming in to tell someone, that the end is necessarily tomorrow, or that it's grim. We're coming in to bring hope. We're coming in to bring, and add what she said, give them extra time with their family. And we're coming in to bring in extra people that can give so much more than what the physician could give by themselves. We have an interdisciplinary group of members that actually can provide so much more care than that one physician could give. And that group of members is so, I don't know how to explain it, because there's so many different members. So we have a physician that makes home visits, and that is unique to Covenant. And then we also have home health aides. We have a social worker, we have chaplains, and then we have volunteers. And all of these people meet together and they talk about the patient. So these patients get that kind of care, and then that's more than what that one physician can do by themselves.
So it's really a team approach. Like
Yeah.
Susie said, we come alongside the primary physician with our specialized roles and team members, and can really support not only the physician, but providing care for the patient and the family. Because it's really kind of a holistic approach. We really view care based on the patient and family as a unit, and meeting their needs, not just the clinical side of the healthcare that we provide, but also caring for the mind, body and spirit, specific to their needs at that time.
Do you see that the local hospitals and physicians are receptive to the services you guys provide?
Yes.
Absolutely. We've got great relationships with the local facilities and hospitals and physicians in our area. Our Crestview branch office serves the north end of Okaloosa and Walton counties, and our Niceville branch office serves the south end of that two-county area. So, Susie and her counterpart Carolyn, our community educators, really work to develop relationships with those in our community who most often see the need for hospice services. So, whether it's a physician or a person in the hospital who might make referrals to different facilities and things like that, they most often can tell based on the patient's diagnoses and their history whether or not they're a hospice appropriate patient. But one of the things that we really are challenged to educate the community on is it's not just a physician that can make a referral to hospice. Anyone can make a referral, and that's really again why Susie's role is so vital in helping to spread the word about what that hospice appropriate patient kind of looks like and what those requirements are for end-of-life care.
And that has changed in the last year. It used to be 6 months or less if someone had a life-limiting disease, and now it's a year or less.
Okay.
And Covenant has been in the market here in Northwest Florida for over 25 years. And so that in itself really tells you a lot about Covenant. When they've been in this area for over 25 years, you can trust Covenant. We're a brand that you can trust.
You mentioned earlier Crestview and Niceville. What is your service area or your market?
Covenant actually is based out of Pensacola, and we cover from Mobile to Pensacola and then over to Tallahassee, up to Dothan and down to Panama City. We actually, in the Crestview area, cover Crestview to Funiac and then over into the smaller areas as well. Then our Niceville branch covers Niceville, Fort Walton, and Destin.
Okay. Well, as far as the cost of your services, are they covered by insurance, or how does
Yes.
the patients generally cover that expense?
Most insurances now have a hospice benefit, and that is what most people's main concern is now, is cost, because of the way the economy is. And Medicare has Part A benefit for hospice, so most of your patients that are 65 and over are covered with their Medicare. And then other insurances have felt the need for hospice as well, and they have come out with a hospice benefit. But with Covenant being a true not-for-profit organization, we take patients regardless of their ability to pay.
And that last year actually totaled over $2.4 million in services to patients who were either uninsured or underinsured. We believe that everyone deserves the right to die with dignity, to be pain-free, and to live life to the fullest up until their last moments. So, really we believe that everyone deserves the right to quality end-of-life care, which is why we provide that care regardless of a person's ability to pay.
And that figure was for our area, Okaloosa, Walton
That was
County.
that was for Covenant Hospice as a whole.
Okay.
So, like Susie said, we cover Northwest Florida and
Okay.
South Alabama. So we're a locally owned and operated not-for-profit hospice.
Okay. Well, we sure have learned a whole lot about what you guys do, and I guess to sum it up, really, you guys assist the hospital or the physician when a patient has gotten to where they're at the end of their life, and y'all assist with, I guess, the emotional and the physical part of nearing the end of your life and how your family and the patient copes with it. And
Right.
it's a wonderful service to have an organization like y'all's that are out there to help people, because I think it's, from what I understand, a fairly new concept. I don't think this has been around that long,
Yeah,
has it?
the hospice philosophy really, it's a philosophy of care that came out in the 80s. Really,
Okay.
is kind of, so it is, compared to most other healthcare movements, it's a very new kind of philosophy of care that, again, is based on pain management, symptom control, and allowing that patient and family to deal with their situation, from a holistic approach, again, with those team members.
Well, like I said, we've learned a lot, and hopefully everybody out there has learned a lot. And when we come back in a few moments, we'll learn a little bit more about what Covenant does, how they interact with our community, and some of the other wonderful things they do. So stay tuned.